This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
A message about COVID-19.
Folks, we've made a lot of progress in our fight against COVID-19, but the work's not done yet. I'm Governor Tony Evers.
And I'm DHS Secretary-Designee Andrea Palm. Contact tracing is fundamental to helping us follow and slow the spread of the virus. If you've been in close contact with someone with a COVID-19 diagnosis, public health professionals will reach out to talk to you.
Please answer the call. It will save lives and help keep Wisconsin families safe and our communities healthy. This is a challenging time, but we can get through it together.
And remember, if you're experiencing any COVID-19 symptoms or think you've been exposed, tests are available. Talk to your doctor about getting one or visit dhs.wisconsin.gov/testing.
Good afternoon, and thank you for joining us for today's COVID-19 briefing with a focus on data and new visualizations on our website. This briefing is being aired live on YouTube, and a reminder to maintain audio quality. Please keep your phones on mute until it's time to ask your question. If you are able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Deputy Secretary Julie Willems Van Dijk, Interim Division of Public Health Administrator Stephanie Smiley, and Dr. Ryan Westergaard, Chief Medical Officer with the DHS Bureau of Communicable Diseases. And we will begin this afternoon with remarks from Deputy Secretary Julie Willems Van Dijk.
Well, good afternoon, and thank you for joining us today to explore some new data elements on the DHS COVID-19 website. We're going to do a quick round of introductions and then dive into the data. So as Elizabeth said, I'm Julie Willems Van Dijk, and I'm the Deputy Secretary of DHS. My background is in nursing and public health, and I hold a PhD and a Master of Science in Nursing. Before coming to DHS, I was the Director of County Health Rankings and Roadmaps at the University of Wisconsin Population Health Institute, where we ranked the health of over 3,000 counties every year based on over 35 different data elements. So I've spent a lot of time with data. Before that, I was a local health officer in Marathon County, so I've spent a lot of time with local data as well, too. Today, I will be giving you a quick overview of the data, of how we use data in our response and the new data visualizations that we have. And let me turn it over to my colleagues to introduce themselves. Stephanie?
Hi, I'm Stephanie Smiley, and I am Wisconsin's Interim State Health Officer and Administrator of the Division of Public Health at the Department of Health Services. And I've been with DHS for 20 years now, actually just last month. And 13 of those years have been with the Division of Public Health, most recently as the Director of the Bureau of Communicable Diseases. I have a master's degree from the Naval Postgraduate School in Homeland Security Studies, and I'm going to be walking you through the specifics of the new data that you're going to be able to find on our website. I'll turn it over to Dr. Westergaard.
Good afternoon, everyone. I'm Ryan Westergaard. I'm the Chief Medical Officer and State Epidemiologist for Communicable Diseases here at DHS. I've been at DHS for I think 1 year and 1 day. But I've been here in Wisconsin for almost 9 years. I'm also an associate professor at the Division of Infectious Diseases at the UW School of Medicine and Public Health. So happy to be here and help answer questions.
Great. Thank you, Dr. Westergaard. Well, as I said earlier, we're publishing 2 new data visualizations today. And before we get into the details on what it is and how to best understand it, I want to provide some further context for how we have used data in our response. Our first commitment has been to timely and transparent data. Every day, we have provided up-to-date reports of the number of people who have been tested for COVID-19, how many people tested negative, how many people tested positive, how many people have recovered, how many people were hospitalized, and how many people we have lost to the virus. To provide this level of data every day is unprecedented. As Dr. Westergaard said in a recent media briefing, it is far more typical for us to report disease data on a monthly basis or even an annual basis. Our team has really risen to the challenge because we know how important information about COVID-19 is to the public. These data help people make decisions about how to protect themselves and their families, including activities like physical distancing, keeping a small social circle, and wearing a facial covering. Our second commitment is to clean and accurate data. And there is a balance that we do every day, a balancing act between timely data and accurate data. One of the things we have to do every day is freeze the data at a certain time each day in order for us to prepare it for reporting and posting to the website. And that is sometimes why you will find differences in data between what is reported at DHS and what might be reported by another entity. And because our disease investigators continue to collect additional information from each person who tests positive for COVID-19, it means that we are collecting further data and then updating data, which is why sometimes on our website you'll see things marked as preliminary data. Some examples of this are things like when people had onset of symptoms, whether they were hospitalized or not, where they lived, what profession they might be part of, are all things that inform parts of our data reporting on our website. And our third commitment is to display data in a variety of different ways to help us understand the pandemic and use our analyses of the data to drive our decision-making and practices. So sometimes this means we look at data by different categories. For example, by age, gender, race, ethnicity. And when we saw high rates of COVID-19 infection in the African American and Latinx populations in Milwaukee, this kind of data helped us decide to locate community testing sites there and what neighborhoods in which to locate those sites. At other times, we look at data by trends over time. So for example, looking at the sustained growth in COVID-19 infections in late June and throughout the month of July raised issues that led to the face covering order issued by Governor Evers last week. And at other times, we look at data by geography. From the very beginning, we have looked at data by county that has helped us understand how COVID has spread throughout our state. And our more recent COVID-19 activity level and maps combines both geographic data at the county level with trend data, looking at the burden of disease and trajectory over time, over the last 14 days. And this kind of data assists individuals in making decisions about how they want to protect themselves and their families, and it helps local governments, school districts, and businesses use this data to guide decisions for them as well. So during a public health crisis, a well-informed public is a safer one. And we want you to have all the information you need to best understand the situation we are in. So we are trying to give everyone the most accurate picture possible of COVID-19 and the pandemic here in Wisconsin. I want you all to know that the DHS data website has earned a grade of A+ from the COVID Tracking Project, which I believe is an indicator that this is a place you can trust for accurate data. So to that end, we continue to add new data to better inform the public about this pandemic. And today we're adding 2 new data elements to the site. As I said, in just a moment, Stephanie will guide you through the data and show you these new visualizations. But let me take a moment just to explain why this data and why now. So for months, we have reported on the number of people with COVID-19 results, either positive or negative, and the percent positive by day. Recently, concerns have been raised about how a backlog in moving negative tests from the staging area in our disease surveillance system into the live reporting area may be affecting these data. So the first graph includes all people with positive and negative results from both this staging area and our live data area, so that people can see the full picture of people who have tested negative and positive and the positivity rate. We've created this graphic by automating the process that matches people with their test results. And so it allows us to report these data prior to the manual process of our public health staff confirming the accuracy of each of these data. So you will see on the graphic that Stephanie will show you an area that's marked preliminary data that indicates there's still a further data cleanup process going on, but we think this graphic will allow you to see all of the data real time based on the result date of the test, and it'll show you a 7-day positivity average over the entire duration of the pandemic. The second component of data that we're adding today is, as you know, we report our results by people with positive or negative tests. And so the second graphic will provide information about the total number of tests administered in our state as compared to the total testing capacity. You will notice that there are more tests on any given day than our report of people with tests. That is because approximately 21% of people that we report have had more than one test. There are many valid reasons for people to receive multiple COVID-19 tests. For example, they may be a healthcare worker or who works in a hospital or a skilled nursing facility, and are receiving regular tests as part of their employment. Someone might have had symptoms of COVID-19 back in April or May, and now it's August and they're having symptoms again, and it's time to get a new test. Most hospitals are testing people on admission, and so someone might have been admitted to the hospital multiple times over the pandemic. As you will see, our growth in lab capacity, which is very good, and we've had the great benefit of our Wisconsin labs standing up great lab testing capacity, but that testing capacity is also matched by the growth in actual tests administered. And that's why it's so important that we continue to grow that lab capacity so that we can meet the growing demand for tests in our state. So that's the background of what we're going to show you and why we're adding this at this point in time. And I'll now send it over to our State Health Officer, Stephanie Smiley, to actually show you the data and walk you through more details.
All right, thanks, Julie. I appreciate the intro here. So what you're going to see on our data page is actually, this is the Wisconsin summary data page that really, for the most part, has not changed. A lot of the data elements are going to be very familiar to folks on this call. And if you scroll down, so this summary statistics piece has been updated with today's data. And so you'll see we're recording an additional 989 positive cases. And unfortunately, another 12 people who have passed away from the illness. So just wanted to point out that that information has been updated for you today. Nothing about what this information is that we're showing you has changed. Everything, all of the methodology behind these calculations remain the same. But what I do want to point out is, if you keep scrolling down here, all of this information that we report out on a daily basis is basically we're showing you the information by the date that a public health worker confirms it. So whether that is a positive or a negative, that is what we're saying here, is by the date confirmed. It is that someone has looked at it, they have brought it into our surveillance system, and it is has been verified as being an accurate test. If you scroll down below, what we have added today is this chart, which is all people tested by positive and negative result, and then also this 7-day average percent positive. You'll notice that we don't have the interactive piece in here quite yet. We do plan to have it so you can hover over each of these data elements, and it will tell you the data, much like we do in many of the other parts of our website. But in order to get this information out to everybody in a timely way, we thought having a static image would be a good way to get that information out there while we continue to develop the back end of the website. So what this shows is the people tested by positive and negative result by the test result date, and this is by person. So again, this is going to be deduplicated. If you're an individual who has tested positive, you're only going to be counted once. No matter how many tests you are getting, you're only going to be counted once in this particular chart. The next area that we have updated is really focused on our lab testing capacity. And so if you've spent a lot of time on this website, you'll know that this has been one of our dashboards that we've had for quite some time. And this lab testing capacity has really shown by day what Wisconsin's daily testing capacity is. And if we scroll down, we have all specimens tested versus that testing capacity. So note here, we've got the testing capacity in Wisconsin here in this background color here. And then we've also added all specimens tested. So what this is going to show is both the negative and positive results. And this is going to also show people who have been tested numerous times. So above, we've been pretty clear that we are only showing, by people, how many people have tested positive. What this does is it actually shows the number of tests that were conducted. And so what we wanted to demonstrate here is how many tests are being run by result date each day to understand, are we getting real close to our Wisconsin testing capacity? And what I'll point out is that you'll note that in some areas, we've actually exceeded some of our testing capacity. And what that means is that we know that we have individuals who get tested, whose test is actually sent to an out-of-state lab. And those test results still count as Wisconsin results, but they are not tested within Wisconsin's lab capacity. And really, for the efforts of preparing and making sure that we have all of the resources available to us in our state, we really wanted to show what lab capacity existed in the state of Wisconsin. So that's why you'll see from time to time, these daily testing numbers go over Wisconsin's capacity. I think I will stop there unless there is something that I failed to mention, Julie or Ryan, that it would be important to mention at this point. Nope, okay.
I think we're ready for questions, Elizabeth.
All right, wonderful. Thank you so much. We will take questions, and a reminder before we do that to maintain your audio quality, keep your phones on mute, please, until it's time to ask your questions. Then you can use *6 to mute and unmute yourself. In the interest of time, we think we have time for one question per reporter and one follow-up. So let's begin with Todd Richmond from the Associated Press.
Hi, can you hear me?
Yes, we can.
Question that I've been meaning to ask for several months. Is there anywhere in the layers on this website that pinpoints where these, which counties actually are leading the outbreak?
In terms of the county level data, you're looking for the number of cases by county?
Well,
we do have.
Right, I'm looking for, today you had 989 cases. Well, where were they? Where can I find that?
Sure. So under our county level data page, we do have all of the information here listed we have maps, and then we also have an area where, and I'm sorry if I'm scrolling really fast, where you would be able to select the county.
Right, but you got to look at all 72 counties, and then you got to write down each total for that day, and there's just no easy way to compare county to county. Right?
Sure, you're looking for a daily update for each county.
Or any kind of update. I mean, without having to look at each county, look at all 72 counties.
Okay, we can probably follow up after this and see exactly what it is that you're trying to locate, and we can get that for you.
Yeah, absolutely. We are happy to get that for you, Todd. Do you have a follow-up? All right, we will connect with Todd after this, and we will move on now to Sean Kirkby from Wisconsin Health News.
Hi, thank you for holding this. My question is, can you talk about when we would see some impact on the data from either the municipal masking orders or the statewide masking orders? Thank you.
Dr. Westergaard, would you like to address that?
Sure. Well, we don't have a great way to predict it. We're hopeful that if there was a widespread adoption of a new effective infection prevention activity, it would start to have an impact immediately, meaning the number of daily transmission events would tend to go down. Since the incubation of the period is between 2 days and 2 weeks, it might take a few days to see that in the data. So really a week to week trends seem to be important, and it's also the other thing to clarify is you can never know that one thing causes any change in the data. Although if we do this well, I think there's good reason to believe that we could make a big difference in bending the curve. Right? Looking at data from just Dane County a few months ago in relationship to the mask order in that particular county, and they had their highest case counts of about 100 and 120 per day the week before their mask mandate, and within 2 weeks it was down in the 20-30 range. So it is certainly conceivable and plausible that you would see a difference within a week or two, and I certainly hope that we do.
All right, and Sean, do you have a follow-up question?
I don't, thank you.
All right, thank you for that. Let's move on to Savannah Tomei from Spectrum News 1. Savannah. Savannah Tomei. All right, how about Caroline Peterson from NBC 15? Caroline, are you there?
Yes, can you guys hear me okay?
Yes.
Yeah.
Thanks for taking my call. So question about kind of inconsistencies in positive and negative tests. I'm wondering if you guys, people testing positive and then coming back with a negative result or vice versa, wondering if you've seen any inconsistencies like that here in this state, and are you concerned that people might be testing too early and getting a false negative because of that?
Ryan?
Sure. There's a few reasons why test results might be different. So the amount of virus that's in someone's nose or throat varies. It can change from very early on in the illness, even before symptoms start. It peaks within a couple days and then tails off. The PCR test, which is a molecular virus detection test that really makes up the bulk of our testing, is very, very sensitive. It can detect very small amounts of virus, but there still is some threshold below which it'll be called negative, and a threshold above which it'll be positive. So sometimes we see tests go from positive to negative on repeat testing when they're at the tail ends of illness, either very, very early before symptoms or very, very late, meaning the person is in the process of recovering. They don't have much virus, but some tests might pick it up and others not. If people are tested during the symptomatic period, so particularly early in the symptomatic period, the tests that we use, these PCR tests are pretty reliable, quite reliable actually. If the virus is present, they're very reliable at detecting the virus. So I would say for the majority part of people who are tested while they're symptomatic, positive test is very strong evidence that infection is present, and a negative test is strong evidence that infection is not present. But at the tail ends, in certain circumstances, it can vary somewhat. And of course, no test is perfect all the time.
And a follow-up, Caroline.
Nope, thank you.
All right, thank you. Let's go to Stephanie Hoff from WisPolitics. Stephanie.
Or afternoon rather, and thanks for taking my call today. So Wisconsin is at 990 deaths due to COVID-19. My question is for, if all of you would like to answer, that would be great. Otherwise, if Dr. Ryan Westergaard would like to answer, how and why are we where we are today in terms of the state's death toll?
Sure, I can start by that. Well, the virus has about a 1 to 2% case fatality rate, which is a thing that we can't precisely estimate, but of the people who develop symptomatic infection and we diagnose, about 1 to 2% of them die. It varies widely, as we've talked about. There's a much lower risk of death among younger, healthier people, people who are older in the later decades of life and who have a lot of other medical problems have a much higher risk of dying from this. So, there's every place where this virus has spread, there's been a subset who develop severe disease and die. The other thing we know is that it's extremely contagious. So every place where the virus has been introduced, it has spread from person to person. How widespread it becomes depends on how well we do prevention. And that's an important point, I think. If we did nothing, the default would be for almost everybody to get this infection. And if that would be the case, many, many people, thousands, millions of people worldwide would die. So that's what would be expected to happen because this virus is so contagious and so dangerous, so deadly, that we would have massive numbers of fatalities from this death. So any level of death that is less than that reflects things that we're doing positively, proactively to prevent the infection from spreading. So the reason that we have nearly 1,000 deaths is because we've done a lot of hard work to prevent there from being many more infections than that. And so that's why we come to work every day, is because there are things we can do to prevent more of our Wisconsin residents and our neighbors from dying. That's what we have to do. Every mask mandate, every recommendation for social distancing is about saving lives. Because if we didn't do those things, that number of fatalities is going to go up and up and up. And it could be extraordinarily large based on what we know about this particular virus.
Yeah, I think I would echo all of what Dr. Westergaard said. This really is, a testament to the fact that, we need to take the mitigation measures that we have in our toolbox, and they are not many, unfortunately. We don't have a whole lot of medical interventions that can, slow the spread of this disease. And so you have to take sort of these non-medical, things to be able to stop the spread. I think one thing that is really important to note is that this is still a relatively new disease that we do not have a lot of knowledge about. And so understanding, how this disease progresses in terms of, how what long-term effects it may have on people outside of, unfortunately, people passing away from the virus, we still don't really know, how much it does have an effect on someone once they are infected. Does it have, what long-term effects? And so I think for us, as public health practitioners, it is our job and our duty to recommend, everything that we can and to help implement things that help slow the spread, especially in light of the fact that there's still so much that we don't know about this disease.
And I would just add, clearly over the weekend, we're going to cross the 1,000 mark threshold for deaths. We've been having 8, 10, 12 deaths a day, and it will likely happen. And so I would just double down on, even though we all have COVID fatigue, we have quarantine fatigue, we have mask fatigue, we're all sick of it, right? But we have to keep doing this. And so please wear your mask. I wear this mask to protect you. You wear your mask to protect me. We have seen the results, as Dr. Westergaard said, in Dane County and other parts of the nation. And so please, everyone, keep taking these actions so that that death rate doesn't get even higher.
All right, thank you so much. Let's move on to David Wahlberg from the Wisconsin State Journal.
Hi, thank you. I want to acknowledge the vast amount of data you're providing on your website, as you talked about. But given that some people were expressing concerns a couple weeks ago about the potential skewing of the positive rate by not including the backlog of negative tests, can you just talk about why you didn't add this new chart until now? Why didn't you include that stuff earlier?
Sure, I'll take that question. So one of the things that has happened in this epidemic is things happen very, very quickly. And so there was really no need to have that chart a number of weeks ago because we were keeping up relatively well with the number of test results that were coming in and our ability to have local and state public health staff review them, confirm them, and move them into the active area of WEDS. In that time that we saw the rise in cases and a subsequent sudden rise in testing, we started to experience backlogs, and that's where we saw this issue develop. The reality is that all of the tests we're getting in over time anyway, and as we've said continuously, that the positive tests, which were the most important in terms of taking action to do contact tracing and to make sure people were following up well, were always being moved quickly. And so the movement of the negative tests wasn't as critical from a public health intervention standpoint, and because none of us were using the positivity rate of tests to do any significant decision making about how we would move forward. If there was some fluctuation from day to day, that wasn't as critical for us. So it was more important for us to have our staff doing the contact tracing than spending time on this more data cleaning effort. But we realized it was going to be a while before we could clear out that whole backlog. And so we looked to our data scientists to find a way that they could adequately match the testing data with the person. That's not a simple task. And so that took us a little bit of time once we recognized we were in this backlog. But our good data scientists were able to do that. We wanted to make sure it was as accurate as could be. So we wanted to run double checks on this. And that is all of what the real life processing of data leads to in order to get us to today when we're able to release these data. So I hope that's helpful in answering the question, David.
And David, do you have a follow-up?
No, I don't. Thank you.
All right. Thank you so much. Let's go to Hannah Jewell from Fox 6. Hannah, what is your question?
Hi, thank you for your time. As you touched on in the last answer, politicians are drawing on your numbers to make some pretty big decisions for our state. So I was wondering, on behalf of some of our viewers, they're getting different comments from different healthcare providers about the importance of taking a test. Maybe they had one-to-one contact with someone who tested positive, like a lot of contacts, someone very close to them, and they're being told unless they're showing symptoms, it's not a priority to get tested, or it's up to you, just things like that. So just wondering what, if you think that the numbers are accurate that you're giving out, or if more people should be tested. My follow-up question would be, if you think anything needs to change with the numbers. Thank you.
I can address the first one about accuracies. I believe our tests are accurate in terms of reporting the number of test results. It sounded like your question was about how well do the test results reflect the amount of cases in the state, in the community. And I think it's very clear that we're testing still a tip of the iceberg. There are a lot of transmission occurring in the state that doesn't get tested. People can go without getting symptoms. And we know that people with mild symptoms who decide to not seek medical attention might fully recover and never get tested. So yes, we have many more cases in the state than are reported on our website. The issue about who should get tested, I think a part of our strategy to find where transmission is happening and intervene to break it does really benefit from everyone who has symptoms getting tested and everyone who is a close contact, meaning everybody who's exposed to a known case, also getting tested. So I think any medical provider who says it's inappropriate to test those people is giving bad advice. That being said, barriers to testing on the laboratory side, on the healthcare access side, are real things. And there are legitimate reasons, particularly if someone can isolate at home safely without coming in for a test. There are valid reasons why we can safely proceed without testing someone in certain circumstances. But I think the big message is that we are testing a lot of people, we're diagnosing a lot of people. The number of people actually with COVID-19 in Wisconsin is much higher than we're reporting. And that's a problem. That's why the epidemic continues to grow, is because we haven't been able to identify everyone with the disease and get them into isolation so they don't expose other people. Until we can do that better, there's going to continue to be spread of the virus in Wisconsin and around the country.
Okay. All right, let's head to Ryan Curry from NBC 26. Ryan.
Hi, good afternoon. My question's kind of piggybacking off of some of the other questions asked. We're looking at the data and the trends, especially this week. It's kind of gone down a little bit as far as number of cases coming in, but still a high number. When you look at this data, how do you assess kind of where Wisconsin currently is at right now with this coronavirus?
Well, if you look at our disease activity map and assessment, it's very clear that Wisconsin continues to be at a high disease activity level. And when we look at that map across the state, which looks at how many cases we've had in the last 2 weeks and whether that trend is growing, staying even, or shrinking, we know that 66 counties are at a high disease activity level, 6 are at a medium disease activity level, and 0 counties in the state are at a low disease activity level. And I think this is really important, Ryan, as we think about this, is those are data over the last 2 weeks. Again, it's really hard to look one day by one day, because there will be fluctuations just based on how many people got tested in a given day, where they got tested. So those trends over 1 to 2 weeks really give us the best picture of what's happening. And I would say we're still at quite a high level and would encourage people to be very vigilant.
And a follow-up, Ryan?
I'm good, thank you.
All right, thank you so much. Adam Rogan at Racine Journal-Times. Adam.
Hi guys, thanks for taking the call. The question would be, Aurora Healthcare Ascension and the Wisconsin National Guard have all reported losses or decreases in testing supplies of late due to federal decisions diverting supplies away from Wisconsin and toward hotspots nationally. Can you characterize why this is happening and how this will affect the state's ability to continue testing people at a high rate or make it more difficult to box in the virus?
Yeah, that's a great question. Thank you for asking it. We are seeing this, that a number of our labs, including the news you've just reported from Advocate Aurora, are having challenges with getting adequate reagent. Even labs like Aurora that was previously getting their reagent in good supply are seeing that their reagent supplies are not coming in and appear to be diverted to other places in the nation. We have been advocating with our federal representatives and with the White House and with FEMA over the last few weeks and months, actually since the beginning of the pandemic, to assure an adequate supply of reagent coming into Wisconsin. And so that is one action step we are taking, that we need that reagent to continue to protect our citizens here. The second thing we have done is worked very closely with Wisconsin labs and Wisconsin manufacturers to find homegrown solutions. So a number of our labs use reagent that is produced here in the state by Promega, and are using that reagent that we can keep here that is helping maintain our testing capacity. So Wisconsin's done some really great things to continue to keep our capacity up. And when you look at testing rates of Wisconsin compared to other states and compared to the nation, as I do each week from a report issued by the White House, we are doing better than the nation as a whole. We're doing better than other states in our Midwest region. And I want to give a lot of credit to our Wisconsin labs, manufacturers for the ability to do that. Having said that, we can't rest on our laurels. The loss of those tests at Advocate Aurora are real, and I know they are working hard to replace them. They continue to have a strong commitment to community testing, which we appreciate and support, and we are hopeful that the testing supply chain will open up soon.
And a follow-up, Adam.
I think this question will be for Dr. Westergaard, and it might just be a yes or no answer, but over the past couple of weeks or so, we've seen a slight, or maybe over just the last week, we've seen a slight jump in deaths, it seems, just from my looking at the chart. Is this a direct result of the rising case count a couple weeks back, even though deaths weren't really going up at that time? Or can you explain why we've seen this slight jump over the last few days?
Yes, I think looking at those two things separately and understanding that there's a lag between people becoming diagnosed and when they develop serious illness and die, there can be weeks in between those two things. So yes, I think that the increase in deaths reflects the increase in transmission that we've been seeing over the past month.
All right, thank you for that. And we will go to Danny Maxwell at WKOW.
Hi, thank you for taking my question. I was wondering if someone can talk about how accurate the antigen test would be, not the PCR, but the antigen, when it comes to asymptomatic people who have COVID.
Yeah, that's a great question. So the antigen test, right, and this is not the PCR that we use widespread. It's relatively new. There's a small number of antigen tests that are approved under emergency use authorization by the FDA. They are not great in terms of sensitivity when it comes to asymptomatic individuals. So they can be so much so that the package insert, the recommendations are that for people who are asymptomatic who have a negative test, it should be confirmed with a PCR test or a molecular detection test. So there are advantages to this type of test because they are less expensive, easier to use. The idea that we could scale up antigen tests and use them on a larger scale and more frequently is really promising. But right now, that is a limitation that for asymptomatic people, they might miss some cases. So there's a trade-off there. I think it's an important addition to our toolkit, but it's important to understand those limitations.
All right, and Danny, a follow?
Yeah, then my follow-up would be, then would the antigen test be considered a good or not a good option for if you were to screen for COVID?
Yeah, I think it's a little bit of both, right? If we're going to screen large numbers, we need multiple technologies. We can't screen, millions of people in this country relying on PCR. We're already seeing that the reagents and the laboratory infrastructure is too great. So there may be a role for testing, for screening using tests that are lower sensitivity, potentially using them more frequently as a part of a strategy to find cases early. There's a trade-off to be made there. So I won't say they're inappropriate to be used for that road, but there are some limitations.
Okay, thank you, Dr. Westergaard. Let's head now to Adam Dexter from WISC. Adam.
Hey, can you guys hear me all right?
Yes, we can hear you.
Awesome. Sorry, my question is not about the new website, but we've been following some outbreaks possibly tied to sporting tournaments throughout the state where teams are coming in from out of state to one location to compete for a couple of days to a weekend. My question is, are you seeing these outbreaks reflected in your data? And if so, how long can you allow events where we have events like these sporting events where people are coming in from out of state? How long can you allow those to happen?
I'm wondering if Stephanie is still here. I don't see her.
Yeah, I'm here.
Oh,
yep, I must have just fell off of your area. So yeah,
our outbreak expert. So.
Yep. So I will take a first stab at this, and basically, yes, we understand that there are many types of outbreak situations, and all of those would be included within our data that we report in our outbreaks and investigations or our facility investigations pages. And in terms of anytime you're getting people together, for any sort of gathering, and sports included, I think that what we've seen in terms of the guidance and recommendations coming out about sports and how to conduct sporting events safely, it's really, really important that people strongly consider perhaps not participating in those types of events. Certainly we want people to remain active and doing having physical activity, but it's when people are coming together and they're gathering, and especially when you're talking about situations where there are athletes that are exerting much more of the sort of exerting their breath, there's going to be a situation where you may end up having that spread, and not to mention the gathering of all of the spectators and people who need to cart people back and forth between different places, and then staying to watch said events. It's not something that we advise at this time, but we understand that people do continue to do it, and it is something that we really believe is not advisable. Dr. Westergaard, is there anything that I missed there?
I think it's a good explanation.
All right, thank you both for that. Let's head to Mason Dowling from WAOW. Mason.
Hello, can you hear me?
You can.
All right, perfect. This question is for DHS, I guess whoever wants to take it. We saw the announcement earlier today that over 200,000 families across the state are getting some supplemental Quest funding for food related to, just unemployment concerns, things like that. Exactly where did the extra funds come from, and how are you hoping to, is this something that is going to be continued through the next few months if the virus concerns, stay where they're at?
Yeah, the funding for that supplemental food comes through the Federal CARES Act funding, and it is linked to in any state that it is experiencing a public health emergency or has a declared public health emergency, those supplemental funds are available through that federal funding. We're very aware that this pandemic is costing people economically. We've all seen the unemployment numbers and the rate of unemployment, and it's very important that we assure that families have food, because that is also a critical piece of maintaining health. So these are supplemental funds recognizing states with high disease burden activity are also likely going to have economic consequences of that. I will also share with you, we're seeing an upsurge in people who are applying for food share benefits, particularly since the 1st of August, when some of the changes in the federal unemployment numbers or unemployment support changed. So there are many ways we're supporting people with food resources through this pandemic.
All right. Denise Lockwood at the Racine County Eye. Denise, are you with us?
Yes. Yes, I am. My question is around like healthcare worker fatigue, specifically for state-run facilities. Yesterday, I wrote a story about the Wisconsin VA in Union Grove having an outbreak of 14 of an 18-unit dementia care residential unit having testing positive, and then also like 12 staff infected with this disease. I'm also told that entire families of these healthcare workers have now been infected, and some of them have been forced to, the people that are healthy are being forced to work back into back shifts. So my question is how are we doing in relieving some of that fatigue for frontline workers at state-run facilities?
Well, I would say this issue of fatigue is prevalent throughout the healthcare system. One of the things that I would say is really positive about our state-run Veterans Affairs homes is they have done a fabulous job of keeping COVID-19 out of those facilities. And as Secretary Kohler said, she wondered how long it would last, and she found out it was 5 months with the outbreak that you're describing today in Union Grove. Some of the things that we are doing to support that particular facility, as we do with many other facilities, is reach out through our State Emergency Operations Center, through FEMA for additional resources to come into the state and provide relief in a situation like that. We have also extensively used a system called Weaver, which is the Wisconsin Volunteer Resources. And we have had healthcare workers volunteer to come in and assist in facilities where they had high levels of staff who were infected. But we know this is real for our hospital healthcare workers, our long-term care healthcare workers, our assisted living healthcare workers. And I would say, as I think about it, part of it is getting back to root cause. It's why we all have to link arms and take preventive measures, because I wear this mask for that healthcare worker as well. And so we all have to work together on the strategies that we know will work to reduce transmission of this disease, to protect our nurses, our doctors, our nursing assistants, our lab workers, and every other healthcare worker in every institution.
Thank you, Deputy Secretary. Let's head to Noah Manderfield of WSAW. Noah.
Hello, thanks for taking my my question. We've seen some counties in our area announce that they're going to have an online reporting system for concerns from citizens who are going to who see people not wearing a mask at business. And I'm wondering if you've seen this across the state and if you've issued any guidance to counties regarding this.
I'm sorry, Noah, could you repeat an online? I don't quite understand.
Yeah, so it's a reporting system for citizens if they go to a business and they see some people not wearing masks, like employees or staff, they can report it to the Department of Health Services to follow up on that.
Can take this one. Yep. So we have heard of many local and tribal health departments that have really needed to figure out a way to collect these types of inquiries and reports. I think that folks were just picking up the phone and calling and and just not really having an organized way to be able to collect all of those incoming concerns. in the business of doing this work previously and have come online, since the beginning of the pandemic, that we were able then to leverage, some of the work happening in our state that, kind of helps us keep that lab capacity contained here in Wisconsin for Wisconsin residents. I think that when we sort of see, the capacity that has been exceeded, that really is showing that individuals have had a test taken in Wisconsin, and that has been shipped out to another lab in a different state. And certainly, when we're talking about lab testing supplies and sort of the shortages that we're seeing across the nation, that's really going to be adding to some of the capacity issues for people that get those tests sent out state. We hope that we won't see our own state lab capacity decline as a result of the testing supply issues, but certainly it is something that we're monitoring and watching, and we want to make sure that Wisconsin residents continue to have as much access to tests as we can help provide.
And I would double down. This is why the question that came to Dr. Westergaard earlier about should we use antigen testing, this is why we should be looking at every new testing technology that's coming out and thinking about ways to enhance our options.
Thank you for that. Let's go to Suzanne Vitale, freelance reporter. Suzanne.
Hello, can you hear me?
Yes.
Oh, perfect. I have kind of a three-part question, so bear with me. In regards to the difficulties with the hospital data, I'm wondering how the conversion process is going and when we can expect accurate numbers. And then I also wonder, with the changes you've made in the data, in what's the graphics that are available now, can we get a graphic showing hospitalizations and ICU beds over time in Wisconsin? I also report on Minnesota, and Minnesota has such a graphic, and it is quite helpful to see the rise and fall.
Yes.
And then one other thing, sorry, okay. I'm sorry. Is it possible to get county data for hospitalization?
Okay, I'll take the hospitalization data questions. We have made a lot of progress with the new HHS reporting requirements and linking the various systems. We're now reporting accurate data both on our site and the Wisconsin Hospital Association site. And so I think you can go to those sites and find that data. I will caution you that we're pulling data. These are dynamic data that are being pulled directly from patient records, obviously de-identified, but and so it will make a difference based on when each website pulls the data to post it. So we are also working with the Wisconsin Hospital Association so that we can time our data pulls to be similar, so you won't find different data on each site. In terms of looking at ICU and hospital data over time, there is a graphic on the Wisconsin Hospital Association webpage, I believe, that shows that. I would direct you there. And then in regard to the county question, we do show hospitalization data by region. It is very difficult to show hospitalization data by county, as we have a number of counties that don't even have a hospital. And so I don't anticipate that we'll be showing data by county anytime soon.
Okay, thank you for that. Our final question from Terry Sater at WISN. Terry. Terry, are you there? All right, well, with that, we will wrap up the briefing. Thank you, Deputy Secretary Willems Van Dijk, Stephanie Smiley, Interim Director of the Division of Public Health, and Dr. Westergaard, Chief Medical Officer. And thanks to all of you for participating. We appreciate your time. We ask you to continue to monitor the DHS COVID-19 web pages for data and for guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, and the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon and a great weekend.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.